Good afternoon, everyone. Thank you for joining us today. This week, the Ministry of Health welcomes representatives from the Caribbean Public Health Agency, or CARFA, to Bermuda for a mission focusing on strengthening visitor-based surveillance and enhancing food safety. As part of this visit, CARFA is doing the following: delivering advanced food safety training, promoting CARFA's tourism and health program, and meeting with technical officers to develop plans to enhance cruise ship surveillance and expand the use of the Tourism and Health Information System. One key activity this week has been the delivery of the Serve Safe Food Handlers Training, which has been facilitated by CARFA and supported by our team at the Environmental Health. This internationally recognized certification equips food industry professionals with essential knowledge to prevent foodborne illnesses and maintain the highest standards of hygiene and food safety. Food safety is a fundamental component of public health. By investing in the skills of our workforce, particularly in sectors that directly engage with the public, we are helping to reduce risk, increase accountability, and enhance both local and visitor confidence in Bermuda's food and hospitality services. We are incredibly grateful to CARFA for bringing this training to Bermuda and to the Environmental Health Team for its leadership in ensuring its success. Every food handler who completes this training is a vital link in our chain of protection. In addition to these capacity-building efforts, today we will also be celebrating a significant milestone: the graduation of Bermuda's cohort of the Caribbean Regional Field Epidemiology and Laboratory Training Program. This marks the culmination of months of hard work and learning by health professionals who are now equipped with critical skills in surveillance, outbreak investigation, data analysis, and evidence-based response. I extend heartfelt congratulations to all of our graduates and sincere thanks to CARFA for its continued leadership in offering this program across the Caribbean. This week's events underscore a core truth: strong partnerships lead to stronger health systems, and through these continued partnerships, we are investing in the safety, health, and resilience of our island community. Thank you to all our partners, our stakeholders, and participants. Bermuda is a healthier and better prepared because of your contributions. Thank you.
Thank you, Minister. Protocols have been established already. I'd just like to say that we actually put on the Serve Safe course. It's an international course, and it was for managers, professional chefs, and food handlers. We had 80 questions, and they just finished the exam, so hopefully they're all successful. 90% they could become proctors, so hoping my team is going to be taking on the proctorship of being Serve Safe proctors. Dr. Lisa Indar from Trinidad, she is the Executive Director of CARFA, Caribbean Public Health Agency. We've been working together for over 15 years, and for some reason she still hasn't got a status yet in Bermuda, but that's okay, we'll work on that. But apart from all of that, I just wanted to sincerely thank the Minister and Lisa and our team for coming to Bermuda to participate. The last time we did this was 2018, and we were going to do it every year, but you know what came after that? COVID. So this is our first time presenting the course to the public, and hopefully that we can do the next one probably in September. We'll see. Thank you.
Honorable Minister, health and all other protocols observed. CARFA is really extremely pleased and excited to be in Bermuda. Bermuda is one of CARFA's 26 member states. And in our meeting this morning with the Minister, we emphasized that our job is to provide technical support to Bermuda as well as all our Caribbean countries so that we have improved regional health security. That is, we prevent disease spread across our borders, and we build capacities to mitigate any form of disease infections. This week, the particular activities that we have been doing, the advanced food safety training, and of course the reward for the FELTEP program, those are two areas that really builds Bermuda's capacity. In our meeting today, we also spoke about the many cross-cutting areas that CARPA also provide in communicable disease surveillance, tourism and health, vector-borne diseases, non-communicable disease surveillance, laboratory strengthening, and others. We are committed to serving Bermuda and serving the region so that through this partnership, we are really better and we are healthier. Thank you.
Thank you very much. We now have a question from Bermuda Broadcasting.
Jasmine, reminders from your broadcasting, whoever is the best place to answer this question, please. After the world has recovered from the global pandemic, can you speak a little bit to the importance of partnerships like the one right now with the government and CARPA? And can you speak a little bit to some of the additional steps that are being looked at to mitigate global communicable diseases and pandemics in the future?
Thank you for that question. And you know, COVID taught us that we must have partners. And COVID was a stark realization that no man is an island and that you required a whole of society approach to be able to combat disease spread and pandemics. And a pandemic means it's spreading to all our countries. But the Caribbean is also, you know, so unique because we are small and we are porous and we're so interconnected. So if we have a disease in one of our countries, because of our travel dependency and our interconnectivity, it's likely to spread across the region. So what are we doing? CARPA has, you know, a series of, we call it a 10-point plan. We have a grant called a pandemic preparedness grant that we are building laboratory capacity, early warning and response systems, and workforce capacity, as well as regional coordination. So we have to go digital. We have to have systems that is capturing illness in real time, as well as giving you an alert. So we have the Nova Tourism and Health Program is doing that. They are capturing illnesses on ships and what's happening on an accommodation setting. And an alert is being given at the same time, so you can nip it in the bud before it spreads. So we're going to expand that to all our surveillance system, vector-borne and others, a normal surveillance being expanded and ramped up. So the early warning systems and building lab capacities, there are novel types of methodologies that you can now test within 2 hours. We want to build that. We want to support also Bermuda and all our countries to be able to rapidly detect. Through our partnerships, CARPA has partnerships with all its member states, as well as key international and regional public health agency. So Bermuda is a UCOT. We work very closely with the UK HSA, with CDC, with PAHO, with WHO, and all our regional health institutions, including our disaster agencies, so that we can, you know, better be able to mitigate. And it's not just, you know, talking, but we walk the talk. We have MOUs and collaborations in terms of activities. In addition to that, we are ramping up how we work. We work jointly, we work in partnerships. We do joint missions so that people can see the integration. We have something called, a body called a regional coordinating mechanism for health security. So that consists of our countries and our agencies where we coordinate our efforts.
Thank you very much to our three speakers. And that concludes today's presentation. Thank you.
Thank you.
Thank you.